The Institute for Family Health is a not-for-profit health organization, founded in 1983. The institute is one of the largest community health centers in New York State. It serves over 85,000 patients annually at 26 locations in the Bronx, Manhattan and the Mid-Hudson Valley. The institute is a federally qualified health center, FQHC, network. Like all community health centers, the institute accepts all patients regardless of their ability to pay and is governed by a board that has a majority of health center patients. The institute offers primary care, mental health, dental care, and social work, among other services. The institute is accredited by the Joint Commission and recognized by the National Committee for Quality Assurance as a Level 3 patient-centered medical home. The institute also leads programs and conducts research to address racial and ethnic disparities in health, advance the use of health information technology, and improve care for diabetes, depression, women's health, and HIV. The institute trains health students and professionals at all levels, including the operation of 3 family medicine residency programs: the Beth Israel Residency Program in Urban Family Practice, the Mid-Hudson Residency in Family Practice, and the Harlem Residency in Family Medicine. History. The institute was founded in 1984 by an interdisciplinary group comprising 2 family physicians, a family nurse practitioner and a behavioral scientist. Since its inception, the organization has been led by Neil Kalman, MD, President and CEO. The institute began as a small private non-profit that received federal funds to open a faculty development program in urban primary care, which it ran for 20 years. In 1985, it contracted with Bronx Lebanon Hospital to reorganize its outpatient department into a family practice center, and initiated its first residency training program in family medicine. It worked with Bronx Lebanon until 1999, and jointly developed several small community-based medical practices. In 1986, the institute acquired the Sidney Hillman Health Center in Union Square from the Amalgamated Clothing Workers Union and turned the multi-specialty practice into a family practice. In 1994, the institute developed a relationship with Beth Israel Medical Center, and began the Beth Israel Residency in Urban Family Practice, opening the Phillips Family Practice to serve as the ambulatory care training site for those residents. Simultaneously, the institute was building and opening a series of small family practice sites. Between 1991 through 1998, the institute opened the Parkchester Family Practice, Walton Family Health Center, Urban Horizons Family Health Center, East 13th Street Family Practice, and the Mount Hope Family Practice. In 1999, the institute received an award from the Centers for Disease Control to initiate Bronx Health Reach, a consortium of community and faith-based organizations committed to the elimination of racial disparities in health in the South Bronx. The group addresses issues related to nutrition and fitness education, access to healthy foods and safe places to exercise, diabetes maintenance and prevention, school food and exercise programs, and the segregation of healthcare in academic medical centers. In 2007, the institute was named a Center of Excellence in the Elimination of Disparities. In 2000, the institute implemented a system-wide electronic health record and practice management system, EPIC. The system has altered the way care is delivered by allowing for increased care coordination and preventive care. The EPIC also enables research in health processes and outcomes, and has permitted the institute to participate in a number of federal and state payment initiatives such as primary care medical homes and achieve meaningful use designation. In 2006, the Institute assumed responsibility for 3 practices operated by Street Christophers, Inc. As a result, it obtained Article 31 licensure to operate 2 community mental health programs in the Bronx. A year later, the Institute acquired 6 health centers and the Mid-Hudson Family Practice Residency Program in the Mid-Hudson Valley, which doubled the organizational budget, the number of staff, and the number of patients served. In 2010, when North General Hospital in East Harlem closed, the Institute opened a community health center on the first floor of the former hospital. 2 years later, the Institute moved this practice to the newly built Family Health Center of Harlem, 2 blocks away, which serves as the home of its 3rd residency program, the Harlem Residency in Family Medicine. In 2012, the Institute opened the Stevenson Family Health Center in the Soundview section of the Bronx, preserving access to care as well as jobs in this underserved and geographically isolated community. Current activities. Mission. The mission of the Institute for Family Health is to improve access to high-quality, patient-centered primary health care targeted to the needs of medically underserved communities. Quote, health services. The Institute accepts most private insurance plans, Medicare, Medicaid, and patients without insurance. Services provided by the Institute for Family Health include primary care, behavioral health, dental care, women's health, prenatal care and delivery, health care for teens, diabetes care, HIV care, some specialty care, home visit services, WIC, veterans services, free clinics, homeless health care, school-based health care, insurance enrollment, and social services. Locations. The Institute for Family Health has over 26 health centers located in the Bronx, Manhattan and the Mid-Hudson Valley. Recognition. Over the years, the Institute has garnered a number of awards for their work, including the RWJ Community Health Leadership Award, the Pew Charitable Trust Primary Care Achievement Award, the American Academy of Family Physicians Public Health Award, the Physicians IT Leadership Award and Davies Public Health Award from the Health Information Management System Society, the CDC Center of Excellence in Public Health Informatics with the New York City Department of Health and Mental Hygiene and Columbia University, the National Physician Advocacy Merit Award from the Institute on Medicine as a Profession, the New York Times Nonprofit Excellence Awards, the Cantor Prize for the Elimination of Disparities, and the Felix A. Fishman Award for Extraordinary Advocacy. http www.institutes2000.org http www.harlemresidency.org http www.midhudsonresidency.org http www.bifpresidency.org http www.facebook.com Institute for Family Health http www.linkedin.com Company Institute for Family Health